The hospital on wheels. The past, the present, and the future. Medical and surgical missions of the Hospital on Wheels. The Hospital on Wheels has conducted medical and surgical missions all over the Philippines, mostly in Luzon from September 2007 to March 2020. We have conducted more than 280 missions and had served more than 18,000 surgical patients, 400,000 medical patients with free one-week supply of medicines, 10,000 dental patients, 10,000 optical patients with free reading glasses. The Hospital on Wheels has also provided education and training to doctors through the lectures and seminars conducted during its missions and its participation in medical conventions and hospital conferences. It has also provided on-the-job training for doctors, nurses, and other health professionals during missions. While the Hospital on Wheels field operations are temporarily on hold, I have continued to do charity surgeries at my surgical center in Quezon Avenue, Quezon City since August 1, 2020, when the city is not strict on quarantine or on lockdown. Since January 4, 2021, in collaboration with the UST Department of ENT, 10 of their residents alternatingly assisted me on charity head and neck surgery cases such as benign and malignant skin and soft tissue tumor excision, thyroidectomies, parotidectomies, revision of cleft lip surgeries with correction of secondary nasal deformities. I also do external surgery in other parts of the body such as benign and malignant tumor resections, modified radical mastectomies, inguinal herniorapies. This is not a complete list, but only the most common cases. We also do many other general surgery and reconstructive surgery cases in the center. Most of it, if not all, these surgeries are done under nerve blocks or local anesthesia. Healthy Lugaw on Wheels feeding program from October 2020 to March 2021. The Hospital on Wheels, through its newly acquired customized minivan, conducted weekly feeding programs in depressed areas in Rodriguez, San Mateo, Quezon City, Manila City, and Caloocan City. We have served porridge with boiled egg to over 30,000 people. The project was temporarily put on hold in compliance with a directive from the local government unit. The home management program for COVID-19 of the Hospital on Wheels, which consists of first aid call center and emergency medical service. On April 2021, in anticipation of the surge of COVID-19 cases due to the Delta variant, we started a program to assist the overburdened Philippine healthcare system. This consists of a 24/7 first aid call center and an emergency medical service or EMS. We trained staff for the call center to provide emergency dispatch or first aid. We also have trained staff serving as the soldiers on the field whose primary role is to deliver, install, and refill oxygen tanks. In addition to this, they also educate the patient and their relatives on the proper use of the supportive equipment. Examples the pulse oximeter, a nebulizer, and many others, and on proper preventive measures. That is, self-quarantine, proper hand washing, and use of masks. We launched the program on July 5, 2021 in Quezon City. Since then, we have been serving many families affected with COVID-19. Our plans: to continue the charity surgeries of the Hospital on Wheels alongside the training program for young doctors at my surgical center in Quezon Avenue. To resume the out-of-town medical surgical missions of the Hospital on Wheels once the COVID-19 situation is controlled. To continue the home management program for COVID-19, especially the emergency medical service, until our budget allows. To expand the operations of the Hospital on Wheels someday to cover all the 81 provinces of the Philippines. Thank you very much. May God protect us and bless us. Together, we can save lives. Almighty God, we thank you very much for this once-in-a-lifetime opportunity to heal countless of my fellow kababayans. You have given me a gift, and with that gift comes an assignment. That is the Hospital on Wheels. Since 2007, these free surgeries and healing for the poor began in a regular-sized van, transferred to a container van, and finally settled on the mobile Volvo bus today, with the intent to reach areas in the Philippines that have no access to these corrective procedures. And more important, these patients will not be able to afford these services even if a hospital was nearby. I lovingly thank my wife and family for their patience, understanding, and giving me leeway in time to utilize this gift in the intent to widen the Hospital on Wheels reach, thanks to the numerous like-minded missioners, local and international, who provided life-sustaining funding, too many to mention individually. Thanks to the formation of the Friends Who Care, LLC, whose officers and board of directors are my batchmates in UST Class 1980, Faculty of Medicine and Surgery, spearheading fundraising efforts and steadily providing resources and moral backup. I humbly thank you, our audience tonight, for your gift of time and support. Life is indeed brief and fleeting. Let us move forward to future challenges and to maximize a vision that has proven cost-effective, plus the upliftment of thousands of underprivileged lives.